The diameter is the measure of the inside of the gauge. The smaller the gauge, the larger the needle. And the manufacturers use colors to differentiate the gauges. 25 years as a nurse, I don't remember those colors. I just read. I'm going to read. It's going to tell me the needle gauge, and that's important for me. So if you young people can remember the colors, by all means. And it's sometimes just based upon what your company orders. If you're not in the hospital, you're not going to have 18 gauges. So your agency may order 1 or 2 size needles. And so that'll be really easy for you to, understand. Any questions on the needle sizes?
No.
And this is just a recap. So when you insert a 20 gauge needle in the patient's arm, it's similar to inserting a paper clip.
That's really big. Yeah.
Oh my God, that's hell.
But believe it or not, it only hurts when you penetrate the skin. And so what you all do is because you all get nervous, or if they're digging, and we're not going in digging and prodding. So what you all do is because you're nervous and you're anticipating this patient's pain, you go in slow. Which means that you increase their pain because you went in slow. So it feels like a prick, but that prick should last for about a second if you go in at a good speed, okay? But if you make it really slow, now the pain has been about 3 seconds, you prolonged it. Take a deep breath in and out. Breathe. All right, so this is a little, this supposedly tells you the size based upon the colors, and looks like blue is going to be the needle size of choice. That's going to be the 22 gauge, and that's for IV fluids or small veins. And we talked about us having an elderly or a geriatric population, and also possibly a pediatric population. You can even go smaller. If they have really fragile veins, you can go with a 24 gauge. What do you all do if the person is anemic and you're just not getting a whole bunch of blood? What's another option? Something about your tubes.
Just try to minimize.
Smaller tubes?
Smaller tubes. So I would recommend you also have pediatric tubes there. And you would call your lab company and say, hey, is it possible for me to use a pediatric tube on an adult? Because I only got maybe 2 mLs or cc's of blood, and the adult ones may take 3 mLs. We don't want to waste his blood, but we just can't send it in the tube that was ordered.
Is it 3 mLs or 2 mLs?
And I may have said it wrong. It looks like it's about 2 mLs. Let's see on here.
Is it 3 mLs?
I think the ones we have it.
Oh,
So this is all we can do.
We have 2 ml too.
So you all have 2 mLs at your job sites? Okay. So this is all you do, everybody, whenever it comes off. Yeah, they do come off. But if they send you the appropriate tube, you won't have to try to transfer it like that, okay? Don't do that unless your lab tells you can do that. All right, so our phlebotomy supplies. What are some of the common supplies you all think that we need?
Gloves.
Yes. Gauze.
Alcohol wipes, the tubes,
They got
everything we got in there.
Yeah. What are these called?
Tube holders.
Tube
Tube
holders. Very good. And then I have it there written out for you. So we have our lab requisition, we have our gloves or tourniquet. It doesn't say the tube holder, but we have our needles. This one says a barrel or syringe, depending on where you work. Remember, I told you that nurses sometimes will be drawing blood out of portacaps or IVAD devices. And so we use like a syringe to transfer the blood into the tube. And then of course we have our tubes or alcohol and cotton or gauze. Standard precautions. It was so important I accidentally put wear gloves twice. All right, so we're always going to wear gloves. We're going to wash our hands before and after every patient. And if you're not washing your hands, you can use hand sanitizer, but I recommend really washing your hands if you're, drawing blood. Dispose of equipment properly. So the sharps need to go into a sharps container, and when we go into the clinical room, you'll see our sharps containers. Keep the needle sterile. That includes both ends of the needle, even the end that's going to be pierced in the tube. Use protective equipment, personal protective equipment such as gloves. Make sure you remove the tourniquet prior to removing the needle. If you don't, you're going to have a lot of blood escaping. And then lastly, never recap needles. Vein selection. Let me see, Larissa, can I get you to read that for me?
Veins feel soft and bouncy. Veins are more superficial than arteries. Arteries have a pulse, and arterial blood is bright red, and damage to an artery can endanger surrounding tissues.
Perfect. So whenever we're in a room and we're assessing, you usually want to start higher up. We can start distally, but if all you're doing is drawing one tube of blood, I'm going to ask the person where were they last successful? Where did you last have a venipuncture? Where did you draw your blood at last? And most patients are not going to go for the hands. They're going to show you their antecubital areas. And so with the antecubital area, the one that's usually most prominent is going to be the median cubital vein. And so with this patient, his palm is up. So the cephalic vein runs along, the basilic vein runs along the vein, runs along the pinky side. And so those will be some of your landmarks. But usually a person in their antecubital area may have 1 to 3 visible veins. Vein selection in the hand. The cephalic vein is nearest the thumb. And there is a vein that runs along the thumb. And when I tell you, when I can't get anything else, once I have that tourniquet on, I can usually get that thumb vein. And so once we have the tourniquet on, it's gonna be more visible. And so you would not wanna put a needle that's 1.5 inches into someone's thumb. But there is a vein that runs along the thumb, and I can tell you, that's like the miracle when they don't have anything left. We talked about someone earlier, we had to use their foot.
Right.
Usually there's a vein right there, okay?
Wow.
All right, and so what are the indications? If you have to use someone's foot, what must you get?
Permission from the
Permission
physician.
from the doctor in writing, okay? But to prevent all of that, what is some type of technology you can use to illuminate the veins?
The vein finder.
Vein finder. So you want to do everything you can to prevent pain to this patient and discomfort. And how many sticks are you allowed to do normally? 2. After 2, someone else needs to come in.
Yeah.
All right, and so some geriatric considerations. So Amy, and I do apologize if I said your name incorrectly. Could you please read that for me?
It's correct.
Okay, thank you.
Okay, use smaller needles and tubes. Use a butterfly instead of
Vacutainer.
vacuum retainer. Use and assess the patient's hearings. Avoid tape. Use
Coban.
Coban.
Mhm.
Minimize hematomas. Apply pressure longer.
Perfect. And something else I put there is probably don't apply the tourniquet too tightly. So,
tightly?
yes.
Okay.
Yeah. Once you've been doing this for a while, you kind of know like the magic tightness of the tourniquet. Like, no, that's too tight. I really killed blood flow instead of trying to consolidate it into one area. And if it's too loose, then we don't have any blood kind of like sitting in the area. So our job is to get blood into the tube, but we can also make it too restrictive where the person has no circulation, and we don't want to do that.
Okay.
All right, so special considerations. Never select the site that is edematous or it has lesions. That could also be burns. Never perform venipuncture above an IV site. Avoid using the arm on the side of a mastectomy. Some patients, after they have their cancer removed, it's in remission, they've gone through their therapies, they get reconstructive surgery. So you can't look at someone and assume they've had a mastectomy. So if you don't have this person's full medical history, I don't know if the clients you have, if they could have dementia or confusion, but you can ask, or you can make sure you go through their medical records. So I don't assume anything. Is it okay if I use your left arm for venipuncture?
Right.
Or is there any reason why I can't? And let them tell me. All right, so that long video for vitamin techniques, we're gonna verify the order. We're gonna identify the patient. Never go to Eunice and say, hey, is your name Eunice? Because if I'm confused, I'm gonna say, yes. It is, can you tell me your name? And can you tell me your date of birth? And if not, they should have identification or some other identifiers with them. You're going to assemble your equipment. Reassure the patient and position the arm. And now you get to do your site selection. Select and clean the vein site. When we apply the tourniquet, maximum 1 minute. If you cannot collect your blood sample within 1 minute, release the tourniquet. You're gonna perform the venipuncture, but what do you have to do before you remove that needle? Number 8, take the tourniquet off, yes.
And then
Otherwise, all that blood that you kind of like hyper concentrated in one area,
coming
will
out.
start coming out, okay? Remove the needle and place in a sharps container. Apply a bandage to the venipuncture site and monitor for bleeding. Agitate the blood tube, that means just gently, you're gonna invert it. You're gonna correctly label the tubes, you're gonna dispose of your equipment, and you're gonna deliver the sample to the lab or prepare the specimen for lab pickup. Alright, so labeling your tubes. Your tubes normally come, or I shouldn't say your tubes, your lab requisition, depending on the company you're with, they usually come out with a label that has the patient's name and ID on it. But then what you're gonna be adding, and it also has the doctor's or the ordering physician's name on it, you're gonna be adding to that collection date and time and also your initials. We've already covered this, how to avoid hemolysis or the breakdown of the blood. We're not gonna ask the patient to pump the fist, that was old school, you can have them make a fist, but what is something else you can do to improve blood flow? Think about positioning.
Yes.
Very good. What about temperatures?
Warm.
So it's other things we can do that can increase circulation, that doesn't increase hemolysis. And then we're going to allow the blood to enter the tube, and we're going to gently agitate. I don't like that word. I'm like, how do you agitate someone gently? We're going to invert the tube. I know.
Hey, blood in the tube.
I know. I'm like, no, I don't like gently agitating. You all will not be performing blood cultures at your place of employment, to my knowledge, but if you were, remember blood cultures are collected first. We use the aseptic technique. Usually your companies will have some type of cleansing solution that is different than alcohol. And you wanna cleanse that site for a full 10 seconds. You never allow the site to, you don't wanna fan, you don't wanna blow on it, you allow it to air dry. And you wanna fill the bottles with the appropriate volume of blood. Most of your vacuum containers, those blood collection tubes, once they are 3/4 of the way filled, they stop accepting more blood. So it has air in it already, and it won't let you overfill them unless you try to use the tube twice. If you try to use it twice, well, then you broke the seal, and now you could possibly overfill it. In most instances, we don't allow blood to be all the way. Once it gets to like the tip of the label, it should start stopping on its own. And also, when you put your label on it, your label should not cover this clear area. Your label should cover their label.
Okay.
Finger stick puncture techniques. Are you all doing any point of care testing?
Yes.
Okay, all right, so we're gonna puncture across the fingertip, we're gonna avoid bone, we're always gonna wipe away the first drop of blood. Do you wanna leave alcohol on the skin?
No.
No, because what type of test could that actually alter?
Alcohol.
Yep, if they're having any type of alcohol testing, having alcohol on the skin could actually alter those drugs. I'm sorry, alter that specimen. And we're gonna collect it in microtubes or capillary tubes. And also if you're checking blood sugars or blood glucose,
Yeah.
and we can do that tomorrow if you're all not comfortable with that. I have the AccuCheck. Venipuncture on babies, alright, so we wanna avoid the center of the hill. I think this was more of a question. We wanna avoid the center of the hill. So let me ask you this, I'm not gonna, even though this is not in the form of a question, if you're performing venipuncture on a baby, on the, where would you actually stick them? The center of the heel, the lateral side of the heels, or the toes? Lateral side, perfect. And you all are correct. And so the areas here indicate the safest areas for you to stick a baby. All right, it's quiz time. Let's see how much you all remember. I'm gonna work backwards. First question is yours, Terry. And Terry, your question is, to begin a phlebotomy procedure, you blank.
Ask the question to tell the first and last name.
Yes. We're gonna ask the patient to tell his first and last name, perfect. You are correct. Alright, and so next would be you, Kanisha. What do you want to puncture during a venipuncture?
A spongy vein.
A spongy vein, yes ma'am. I forgot I have the answers there, it's not cool.
Well, we don't look ahead.
Alright, so Christina, if the patient has an IV, your best choice is to
Use the other arm.
use the other arm. And this one's gonna be yours, let's see. Larissa, have I called on you?
A needle's colored cap indicates the gauge.
Yes. And then this is just a reminder that we've already covered the different colors and the gauges and their uses. And then this will be your Soimi. What size needle is best for venipuncture on an adult from the sizes given?
Is that 22?
It is a 22 gauge, it is, that is correct. Alright, and now we're up to you, Christina. Whenever you're puncturing the skin, which of the three, do you want to puncture at 90, 45 degrees, or 15 degrees?
15.
15, so usually less than 30, okay? So it's like an airplane coming in for a landing. Not an airplane nose diving.
In one end, out the other.
Yeah, and so that is the end of our PowerPoint presentation. It covered what the video covered, but at least now you have something that you can take back to the office with you. And now we'll give you a quick break. I'll turn off the cameras, and then after your break, you can get up, I'll cut that off. And then afterwards, that gives me time to set up the task trainers. Okay, so I'll see you in a few moments. You don't have any questions?
No.
Okay.
Who's our prescribing doctor? I guess I need to be notes at one time.
Okay. It's all set up in request.